Okay, sir. Uh, Good evening, everyone.
Six. Yeah, just wait.
So, should I
Just a
start?
minute more. Yeah, just wait. It's not yet six. It's 5:59. Mobile time. And this Gosumec foundation video instead of the slide presentation. Tushar is aware.
Yes,
So,
sir.
okay, general. Yeah, fine. So, just wait. When it becomes six, we'll start. Yeah, you can start now, please. Laura, you can start.
Okay, sir. Good evening, everyone. The Dr. Manu.V.L.Kothari Chair and Division of Medical Humanities and the Gosumec Alumni Association, under the patronage of Dr. Sangeeta Rawat, Dean Sagius Medical College and KM Hospital, welcome you to this session of feminism. I request the tech team to play the video of Division of Medical Humanities. It is the students of past and present that make our college what it is. So, as our twin institutes move towards their centenary, you wanted to give a virtual platform to every batch of GSMC to share their fondest memories of college. Their thoughts and emotion will be preserved forever in the form of these reminiscences. I request the tech team to display the GA membership form and to remain connected to our alma mater and informed about the activities in KEM, including its centenary celebration. We request you to become the members of Gosumec Alumni Association, the official alumni body at Sage USMC. All the details and this membership form are available on KM website. We would also like to take this opportunity to tell you about the newly started Gosumac Foundation. I request the tech team to display the Gosumac Foundation video.
Introducing Gosumec Foundation USA, where our mission is to connect, contribute, and engage. We aim to foster a dynamic connection within our geographically diverse community while nurturing the growth and development of our alma mater. Central to our mission is the paramount goal of supporting student welfare, ensuring the next generation of graduates receive the resources and guidance they need to thrive. Please visit our website, gosumec.org, and delve into meticulously curated content showcasing the captivating history of our institution, along with notable milestones and achievements. Discover insightful pages dedicated to the MVL Kothari Division of Medical Humanities and delve into the treasure trove of our alma mater's archives. Engage with our dedicated studio page and immerse yourself in inspiring features such as Alumni of the Month and insightful contributions from experts like Dr. Dilip Jeste and Dr. Jag Singh. With something for everyone, gosumec.org serves as a dynamic canvas for collaboration and growth. Exciting news! Our secure web based portal, now complemented by a convenient mobile app, is officially live. To join Gosumex worldwide, yes, even from Iceland, simply click the login link at the top right corner of our webpage or visit alumni.gosumec.org. Our alumni community progresses through four stages: recent graduates navigating their entry into the professional world, early settlers establishing careers and families, seasoned professionals leveraging their expertise to empower others, and legacy members creating a lasting impact for future generations. Through our foundation, we unite alumni from diverse backgrounds, fostering a sense of belonging and camaraderie. Here, you can securely engage with one another, share wisdom on message boards, and thrive by creating and sharing content. Additionally, benefit from various opportunities, including training positions, jobs, and who knows, you may even find your life partner here. Join us on this journey of connection, contribution, and collective engagement. Join us in expanding our global community by becoming ambassadors of the Gosumec Foundation. As leaders and class representatives, your role is pivotal in welcoming fellow Gosumec friends and fostering engagement. Connect with one another, share insights, seize opportunities, and participate in vibrant message boards. Your contributions, including sharing artistic content, enrich our community, transforming it into a valuable network of connections. Together, we navigate the complexities of our world, supported by the bonds forged within our Gosumec family. With gratitude, Sanjay Bindra, representing the board at Gosumec Foundation USA.
Gosumec Foundation has started an exciting scholarship program for students, and to tell you more about it, we have a small video by Dr. Sanjay Bindra, president of the foundation.
Gosumec Foundation USA scholarships passionately strive to empower deserving students by offering crucial need based support, unlocking doors to success, and shattering the constraints of financial barriers. In its inaugural year of 2023, the Bridges to MBBS and More Scholarship with Jyoti Shanbag Haven Initiative proudly embraced and uplifted 17 scholars, comprising 16 dedicated medical students and one passionate occupational therapy student. Notably, the initiative celebrated the inclusion of four inspiring female scholars, marking an important step towards a brighter and more inclusive future. In the heart of Seth Gordon Das Sundar Das Medical College, the growing demand for financial assistance resonates deeply, especially among our dedicated students pursuing paths as occupational therapists, physical therapists, and medical technicians. It's disheartening to acknowledge that occupational therapy students and medical technicians, despite their immense dedication, do not currently receive government aid, making them the most vulnerable in their need for support. Together, let's bridge this gap and stand strong with these aspiring professionals. The Gosumec Foundation USA passionately envisions a united Gosumec community supporting our noble cause, the Collaborative Scholarship Project. We dream of creating a nurturing space for students globally with backing not only from the US, but India and globally as well. Guided by Dean Dr. Sangeeta Rawat, this initiative will persist in championing students, fulfilling their financial needs, and offering invaluable mentorship through the Dosti initiative, transcending borders and fostering dreams. The Gosumec Foundation USA pledges to amplify the impact of every rupee raised in India, creating an exponential doubling of support that reaches even more students. Every rupee raised in India will be matched by the foundation. Contributions in US dollars from the US and around the world will find their way to the DGST account at KEM, while Indian donors can directly contribute in rupees, enjoying tax advantage donations to DGST. The joyous anticipation of students upon receiving this much needed scholarship is a testament to the transformative power of collective generosity. Let's come together, hand in hand, and passionately spread the message. Let's encourage and uplift one another to support this noble initiative, benefiting numerous aspiring professionals at our beloved alma mater, a place that has enriched us both professionally and personally. The unifying force of gratitude and generosity is poised to unleash an avalanche of much needed assistance, ensuring the enduring legacy of our cherished institution. Together, our collective efforts will make a profound impact and carry forward the spirit of giving back. The need based support provided by the Collaborative Scholarship Project is not just a financial aid, it's a catalyst for a virtuous cycle. In this cycle, today's recipients are poised to become tomorrow's donors, creating a profound amplification and sustainable continuity for this heartfelt initiative. It's more than assistance, it's the transformative power of reciprocity, goes through the hands of those who were once recipients. Exciting news for Indian Gosumecs. Join forces with Dean Dr. Sangeeta Rawat, Dr. Lopa Mehta, and HOD Physiology Dr. Shenvi. Your participation can create a meaningful impact as you contribute tax-deductible funds to the Diamond Jubilee Society Trust, DJST. For every student supported with rupees 60,000 in fees, Gosumec Foundation USA will match that support, thus doubling the impact. Don't miss this incredible opportunity to collaborate, create positive change, and support a cause that truly matters. With gratitude, Gosumec Foundation USA.
Sir, I think that Dr. Vinita.
Yeah. Okay.
Okay.
Sure.
Can you see them?
Yeah. बस में
Hello.
Hello.
Hello, madam.
Hello. Namaste.
Namaskar. Very nice to see you, madam.
Yes.
Good morning.
Oh, hey, volume वाढवता येतो का?
No, your volume is heard. Is our voice heard, madam? Am I audible,
Yes.
madam?
Yeah. You're audible now.
Yeah. So it's been very nice to link with the senior most Gosumec online with the latest technology.
Yeah.
More than, in fact, as on date, you're the 95, if I'm not mistaken.
Yes,
15 February.
95. Just completed it. On the 15th Feb, I completed 95.
Yeah, incidentally, 15th Feb 1926 is the date when the first patient was admitted in KM Hospital.
Oh, I
Also,
see.
it's a more than coincidence that we have somebody who was born 3 years after that, now virtually on this platform. Madam, so please feel free to speak from your side, and we will keep on interacting with you.
Yeah. You had asked me why I chose the doctor's profession. I chose doctor's profession because when I was a child, my grandparents used to be ill, and the doctor's visit was so eagerly awaited, and everyone felt so much relief after the visit. I came to know that doctor relieves the distress and is respected for that reason. So
Yeah, very nice to know that, madam. Yeah.
And I chose this St. G.S. Medical College, and it was ranked number 1 then, and also because my maternal uncle, Dr. R.P. Kopikar, professor of anatomy and also dean of the JSMC and KMH, was present there at GSMC. So I chose that college.
It is great to note that you are related to the first head of department of anatomy.
Yeah. He was my mother's cousin.
And there were many other relatives of Dr. Kopikar also who joined the institution in much later years.
Yes.
Yeah. And I think Dr. Kopikar also was linked with museum being set up, medical college. That's what we had heard.
He was dean of Manipal Medical College. After his retirement from Gosumec, after his retirement, he went to Manipal and he became a dean there, dean of the college and the hospital.
Manipal Hospital, the medical college, the museum is one amongst the top 10 in India.
Yeah.
And he was the
he
prime person to.
Yeah. And he built up a museum in our GSNC also.
Oh, that's.
Yeah. And I have 2 contributions to that museum also. I was good at dissection, and I had dissected the posterior triangle of the neck, and he liked that dissection, and he preserved that for the museum. And another thing was a skull, full skull, on which I had shown the orbital muscles, all the cranial nerves, the cortical areas, all that was depicted on that skull. That is also in the KM museum, anatomy museum.
Yeah, that museum has a great collection. Only thing is, all specimens are not labeled as to who created them. So maybe looking back, we will be able to make out these 2 specimens.
Yes.
Now
So now what? Yes.
Now the museum is relocated in the pathology museum. The building, pathology museum building.
I see.
Yeah. Madam, what about your recollections
of
1946?
It was great looking at the JS Medical College. I really felt it was magnificent, imposing stone building, and I was filled with pride for belonging to the institution. There was a small green circle between the gate and building.
Yeah.
And first I was interviewed by Dr. Daigude, who was the dean of JSNC then. And he commented that I must put on at least 5 pounds because I was very skinny, and I used to wear frocks at that time. And then on admission, I changed my apparel. I changed to wearing my sari and improved my diet and put on weight. He had said that my admission will be cancelled if I don't put on 5 pounds in the first term.
Madam, do you have any photographs of that time of yours?
My photographs, no, I don't have any. I have a photograph only at the MBBS graduation ceremony. That photograph I have. But
it would be nice if we could see it
on
the screen also, so that we know how you were at that time.
Yeah, विनीता माझं ते पुस्तक आणि त्याच्यात माझा फोटो आहे बघ.
And how was the admission process?
Admission was very easy. He only interviewed me and that's it. And then I was taken in. Dr. Kopikar and Dr. Kurulkar taught anatomy and embryology. त्यांना दाखवायचा हा फोटो विनीता. त्यांना मी कशी दिसते
काय झालंय
काय गेलं कसं आय डोंट नो.
Okay, madam, no issue. In case as and when it becomes available.
No, it's there, but the Zoom link went away. So
No, you're there very much on the link. I can see you.
I can't see you.
Okay, never mind.
Can you
show? You
Yeah.
can show.
Yeah, the same.
Can you
Yeah,
see-
beautiful.
There.
Oh, fine. Yeah. That's wonderful. Yeah, great. Yeah.
And Dr. Kopikar and Dr. Kurulkar taught us anatomy and embryology. And Dr. P.M. Mehta used to teach us surface anatomy. P.M.
Okay.
Mehta.
Dr. P.M. Mehta's son, Dr. D.P. Mehta, Dilip Mehta, was also teaching anatomy. He joined in 1958 at GS Medical. Yeah. Yeah.
And he taught us surface anatomy very well. Very nice. I liked all my teachers.
And who were the teachers in physiology?
Physiology, there were a lot of changes. One senior doctor, Batliwala, was there. He retired. And after that, there were some changes. And one Arthur, some D'Souza, or I think Arthur D'Souza or somebody, some Christian person was there. I don't remember the name.
No problem. And how the course duration of first year was 2 years? Then?
Yes, it was 2 years.
Okay.
But we used to feel at that time that I wish I had visited the wards during my first MBBS. I was longing to go to the wards and see patients. But
what was the total duration of the course? First year was 2 years.
First MBBS was 2 years.
Okay, second year?
No, 2 years course for first MBBS.
Oh, first year. Yeah, right. Yeah, understand. Second MBBS?
Second MBBS was again 2 years, and final was 1 year.
Okay. Okay, so total 5 years.
Total 5 years. I think in second MBBS.
Plus 1 year of internship.
Yes. And for second MBBS, we had pathology, pharmacology, biochemistry.
Yeah.
And we had very good teachers. Medicine, Dr. J.K. Mehta and one other Dr. Mehta were there for medicine. Dr. Nathubhai Patel was also there. All three.
Patel.
Yeah. And for surgery, we had Dr. A. Baliga.
Oh.
His bedside clinics used to be superb. I used to be very fond of that. And I used to sometimes miss lectures to attend Dr. Malika. And
And the gynec department?
was Dr. B.N. Purandare. He was,
okay.
and again, his surgical skill was so immensely pleasurable to watch. The way he moved his hand as if things used to fall into his hand, it looks like. It looked so easy for him to operate. Superb. Then surgery was taught by Dr. Arthur Disa and Dr. P.K. Sen. P.K. Sen was the one who did the first cardiac transplant. And for pediatrics, we had Dr. S.M. Merchant and Dr. R.V. Sansgiri. These were taught at the Wadia Children's Hospital at that time, and not a part of KM. Later on, I think it merged with KM.
What about ophthalmology?
Ophthalmology, I remember Dr. Maskati was there, and that was a very good department again. Very, very popular. I was thinking of taking up ophthalmology after my graduation, but then I changed my mind.
Kriti was a year or two senior to you, if I'm not mistaken.
Who?
Dr. Maskati?
Yeah, I think 2 years, 1 or 2 years senior to me.
Do you recall your batchmates, madam?
I remember my partner, she was Miss Acharya at that time. She was my partner for anatomy dissections. But there is no trace. I have not met her or heard about her later. Then Dr. J.T. Bhatia was my friend. She opened a nursing home at Borivali, but she is also no more. And Dr. Gujral, Pushpa Gujral was my friend. But she was from Delhi, but I have no contact with her. But one funny thing.
Dr.
Yes. What?
Dr. Satoskar, who was later in Department of Pharmacology.
Pharmacology. Yeah, he was my classmate. And Dr. Kekre also was my classmate, who became dean later. And he was the one who called me to teach anatomy when an extra batch was added to TNMC. Before that, earlier I had taught at Grant Medical College for 10 years.
So after graduation, you joined the Grant Medical College.
Yes, yes. After graduation, I did house posts in gynec and obstetrics at Lokmanya Tilak for 6 months and 1 year at Kama and Alblets. And after that, I was looking for a for a house post in medicine. But meanwhile, this job came up in GMC. So my mother suggested, you were good at anatomy. Why don't you take this up? So I thought, yeah, it's a good idea. And I said, let's join and see. And at the same time, I was planning to get married. So I thought for a married person, a course in this field will be more convenient so
Yeah.
that I can look after my family with a lot of vacations and all that. So that's how I continued at GMC for 10 years.
What was your perception at GMC after having seen GS Medical College, anatomy department, and then at the GMC later?
Yeah, GMC was very nice because I knew Dr. Um, um,
There was one Dr. Lata Mehta.
Doctor, no, I had met her much later.
Acha.
I knew this Dr. Dastur and Dr. Sitna. They were my professors at GMC. And Dr. Dastur was already my examiner at my first MBBS. And he was quite impressed with me at that time. And he later came to know that I was Dr. Kopikar's niece.
Okay.
So he was happy to have me at GMC. And I did my junior and senior lecturership at GMC. It was nice. And I liked the atmosphere, with much wider area. It was the whole academy had a much bigger area than GS.
Yeah, much older institution.
Yeah, much bigger. And their annual gathering used to be very nice. This Kashinath Ghanekar, he was a prominent actor on stage later. He was in the dental college at that time. And he presented a drama in the gathering, Gadambicha Bapu. It was a very, on Marathi stage, it was a very popular drama.
How was it at Nair later, madam?
Nair, yeah, again, there, Arthur D'Souza, I think, was the professor at that time. And I also knew him, so it was very nice. I was there as only a part-time person. Because I was already um, practicing GP then, and I used to go there only in the afternoons. For 4 hours, I used to. And at that time, there were more girls in the anatomy department. There were 3 lecturers in anatomy. Whereas in GMC, I was the only lady.
Was Dr. Kalgutkar there at Nair?
Yes, Kalgutkar was also there. He passed from GSMC, but he was there at Nair. But Kalgutkar was there only for a year, or just before I joined, I think he had left. He was not well. He left.
Madam, your memories about Dr. Kopikar?
Dr.
in anatomy department.
Dr. Kopikar had a very good personality. He was a very good speaker. He was very good at sports also. And students used to like him very much. And they used to invite him to inaugurate various programs that they organized. Very jovial and very nice person. Very kind and
How were the extracurricular activities during your time?
extracurricular. Not,
Meaning
not many.
drama.
Not much actually at our, but at our time. Later it improved. And Avishkar and all that, they started later, not in my
Much
time.
later, yeah.
So there wasn't much. GS was known more for the academics.
Yeah.
Debates, you said.
And I think Silver Jubilee function.
Used to be there. Debating was very popular then. And the Udwadia brothers, Farooq and Tenton, both, especially Farooq, was very good. Always won the debating competitions.
I think they're from 48 and 51 batches.
Yeah.
Junior to you.
Yeah. I met Hampton again at GMC because I wanted to, before I started my general practice, I wanted to learn minor surgery, improve on my minor surgery skills. So I attended this Hampton Woodward's clinics at that time for 3 months.
How was it during pre-independence era? Because 47 was independence.
Yeah.
So any recollections from 1947?
Yeah, that was as a Jalosta. Everybody came down on the street on the night of 1947. They're all everybody was walking on the street, and there was illumination all over Mumbai. And my brother had taken a lot of photographs, but those photographs are lost. I don't have them with me. But it was a great experience. Everyone was so happy and jubilant, roaming on the streets, waving hands and there was Nehru's speech that was broadcast. Nehru's speech was broadcast to the states. So it was a great event.
And you had any interaction with Dr. Jivraj Mehta, the first dean?
Jivraj Mehta. Yeah, Jivraj Mehta, yes. On my first interview, actually I met Dr. Jivraj Mehta first. He again commented on my skinny appearance and he said, you have to put on weight, otherwise, and during the first term, otherwise your admission will be cancelled.
Any recollections of the Silver Jubilee function, 1950, of the college?
Yes. That was that time, this music concert, Kesar Bhai Kerkar was invited for that. She sang for us. It was a beautiful.
Those souvenirs are there in the.
Pardon?
No, those souvenirs of the Silver Jubilee and the Golden Jubilee thereafter are available in the institution. So in which the records, the data are there. But your personal experience at that time.
Personal experience I remember is this Kesarbai Kirkar's
Okay.
program. That's all I remember. I don't remember anything else.
The batch junior to you, 1947. I'm told that there were people who joined from after partition. There was an additional.
Yes, this Dr. J.T. Bhatia was one of the refugee girls who joined afterwards. She came 1 year later, she joined us for first MBBS.
Okay. Any memories of the wards at KM?
Wards used to be very, no, I wanted to write.
Yeah, you could go ahead from that, madam. Yeah, those questions which are there.
Yeah. I enjoyed going to the wards, seeing the patients, taking history and watching their progress. That was very interesting, entirely different and new. And the bedside clinics in the ward rounds. After the ward rounds, the honorees used to take bedside clinics. Those used to be very, very informative. I remember one experience on the first day of my first surgical term. I was assigned a burns patient in ward number 5, and he was covered with bandages from head to foot. I pulled the dressing trolley by the side of the bed and tried to make the patient sit up. But just that little moment made he faint, he collapsed on my forearm and died on the spot. that scene has stayed with me. We, in the wards, we learned patience, perseverance, careful observation, and diagnostic skills, how to communicate with the patient's relatives, how to reassure them. All these qualities were slowly developed in me. Apart from Udwadia brothers, I remember Dr. Datta Pai, who started this preventive medicine. I think he opened a hospital of his own also. And another, there were Cooper sisters with me. They were my classmates, but I don't know further what they did. Dr. Vittal
Can you recall from
Dr. Vittal Prabhu, again I remember, he became a very successful GP. I don't know how many of them are alive. I have no contact with anyone now.
There is one member from 1945 batch, Dr. Gigi Parikh.
Yeah. Oh,
He is
yes.
now in his 100th year.
Yeah. Oh,
He is
yes.
still, he's,
I knew him very well. Yeah. J.D. Parikh. Yes.
we are
Because of
trying to see whether we can also get him for an interview as and when possible, but uh, do not know as of now whether we'll be able to succeed in that.
actually, because of him, I took the gynec and obs because he was gynae obs, J.D. Parikh. I couldn't decide which branch to join after my graduation.
How was the admission process for post graduation that time?
No, not difficult. They just
Okay.
saw the marks, interviewed,
Okay.
and that's all.
Okay.
Mm.
Any recollections from Department of ENT teachers,
Yeah.
orthopedics?
Orthopedic, we used to be somewhat scared because the patients, they were on slings and all. It used to be a bit scary thing. But the teachers were very good. I don't remember the names of the teachers then, but they were good. All teachers at KM were excellent, all in all subjects.
Any information regarding hostel, ladies hostel?
I stayed there during every exam term, during the last term, that is the exam term. I used to stay for first MBBS, second and third, all three MBBS. For one term, I stayed in the hostel because I could go to the library and read. Library used to be open till 9 p.m. So I would study there till because I could concentrate best at the library. So I used to love reading there. From there, it was short walk to the ladies' hostel. Hostel was,
Opposite.
yeah, hostel was, and our in charge madam was also very good. I don't recollect the names now.
And how many of you were there in the room at that time? In the hostel room?
No, we had each a room for us, single room for us, one room. We were not sharing rooms.
Okay.
For first
And
one,
you have
the one term, I think we had two. My dissection partner and me, two of us were in the same room in the hostel. But later on, we had a room for us each. That's what I
when you
think.
were when you were not in hostel, where you were staying at which locality? From where you used to commute to the college?
I used to come from the other.
Acha.
Hmm.
Tram was there at that time?
Trams were there. Trams were there, but I used to come by bus
Okay.
from Parel from Dadar to Parel. A bus was there. That was more convenient. From
And how much was the ticket charge at that time from Dadar to Parel?
I don't remember that, but it
Okay, no, they just
wasn't
must
much.
be. How was the fees structure in medical college? Roughly, term fees or okay. Any recollection regarding the term fees or I guess there was no stipend during internship for your time.
I don't remember having done the internship there. Maybe there was no internship at my time, probably. I feel like that. Because I straight away joined the Lokmanya Tilak as a house surgeon.
Acha.
There was no internship. Yes, I remember very well.
Acha.
After the exam, I just went on a holiday to Bangalore. And then on my return, all the posts at KM were filled up. So I had to take up a post at Lokmanya Tilak.
I think Lokmanya Tilak started in 47, the hospital. I just
Yeah.
started 1 year.
Yeah. It was in barracks, and in the
Yeah.
beginning, it was only in barracks. Then it was built up.
Any memories from Lokmanya Tilak Hospital?
Yeah, it was very nice. It was. I remember two teachers over there, one for medicine and then for gynec, but I forget the names. Medicine one had a daughter studying in KM later. And yeah.
When did you visit KM last, madam?
KM,
how many years ago?
Many
You left
years.
after first.
Several, very, because I have came here to London in 2016. And before that also, while practicing, I didn't go. I was practicing in Santa Cruz, living in Santa Cruz. That was quite far from this KM. So, but my servant used to stay in Parel, just close to the hospital. So his family used to go to KM for all their needs.
And how was ragging at your time? Was there any ragging?
No, not much. At least I didn't get ragged. There wasn't much ragging. It came later on, and that was more at GMC. When I joined GMC, the ragging used to be more there. And for the election votes, those things were also more boisterous at GMC. For
There were
selection.
200 students were there at GMC per batch.
That
GS later became 160, but I think during your time there were 80 students.
Our time, I think there were 100 only.
Okay.
50 boys and 50 girls.
In GS?
Yes.
Okay.
Later, it increased. And when I joined TNMC as a teacher, that time I think they added the special extra 50. They had 100 and they added 50 more.
Our institution will be celebrating centenary next year, 2025.
Yeah, centenary, yes.
And college started in 1925, first batch.
Mm-hmm.
And then the hospital started in 26, Foundation Day, 26 January. With the first patient, as I said earlier, admitted on your birthday, 15th February 1926.
Oh. Mm-hmm. which was very nice. But I really liked my KM hospital days. It was very, very nice.
Madam, we would like to know the secret of your memory. The way at this age you are recalling everything. And with technology, you are so well conversant. You are very active on WhatsApp.
Uh, I maybe I just kept doing things. I was keen on knowing new things and learning new things. Reading also, I kept reading. I was fond of languages. Actually, my initial um, idea was of doing MA with Sanskrit. I used to like Sanskrit very much. Then I was studying on scholarship. So the secretary of that trust, they said, no, if you join, if you take up science and join humanities, you'll be more useful to the society. Literature you can always read later.
Okay.
So that is how I joined science.
Okay.
I was good at science as well, but my personal liking was for languages. I used to like Hindi, Marathi, Sanskrit, English, all languages I used to like, and I like literature.
Which college you came from before GS Medical Science from?
Ruya, Ramnaran Ruya.
Ruya. Oh,
Yeah,
that's great.
it was walking distance for me. I could walk,
Okay.
cross the Tilak Bridge and go reach.
And the schooling prior to
Schooling,
that?
schooling was up to eighth or ninth was in Indian Education Society, the school opposite the other station.
Hindu
That was,
colony.
no, not, they had a branch in Hindu colony. Mine was on
Achha.
this side, opposite the railway lines.
Achha.
And there they started King George. They called it King George, and they added an English medium batch there in their education. And I had 2 years at Bessel Mission High School. For my 11th and 10th and 11th, I studied at Bessel Mission High School because in 1942 there was evacuation of Mumbai. There was a scare of Mumbai being bombed. So Mumbai was evacuated, and I went to my grandfather's house at Dharwad and in Karnataka state. And there I studied at Basel Mission High School. But that helped me to improve my English.
Any other life experiences you'd like to share with us, madam? In meaning of unforgettable memories.
Unforgettable memory is this. The first day in my, did I tell you about that? First day of my surgical term.
Yeah, you told us about that.
Yeah,
Yeah.
that
The
bird.
burns patient.
Yeah,
Yeah, that you said. Yeah.
yeah. And another burns patient I treated as a GP. She was in the same society as me, and the old lady, about 70 plus, and she was a Gujarati lady, and she was, her pallu caught fire. She bent down and doing aarti, and the pallu got caught fire. And her her abdomen, thighs, and chest, all more than 70% area was burnt. But she refused to go to be hospitalized. She said, no, I trust you, you treat me. She begged, and then I said, okay. I managed. I gave her saline for 2 days. I cleaned her wounds, dressed, moist dressings, and all that I did at home. And she recovered fully. All the 70%. I took the risk myself. I didn't call anybody. And she recovered really beautifully.
Oh, that's great.
And then I learned acupuncture because I found I had seen a pamphlet when I used to go to Pune Medical College as an examiner. There I saw a pamphlet about acupuncture. And looking at that, I saw the points had some relation to anatomy. I thought it will be very easy for me to learn. So luckily, someone started teaching, a medical doctor only, Dr. Loya. He started his acupuncture classes in Mumbai. So I joined, learned acupuncture. And then I had a patient, a 24-year-old boy who had severe backache. And his father, I used to stay my clinic was on the first floor. The boy's father helped him come up the staircase up to my clinic, and he came and the boy said he wanted to attend a hiking camp next day. And he was almost in tears because he thought because of backache he won't be able to go. So I said, let's see what. And then I put him my examination coach, and I gave him acupuncture. And after half an hour's treatment, he got up, and there was no pain at all, and he was so happy. He went down the staircase without any help, and he could go attend that camp as well next day.
Oh,
So
wonderful.
I was so happy about the acupuncture, that so much so that I started treating most of the patients with acupuncture only. Instead of giving them medicines. I become an allopathic doctor, changed to acupuncturist.
Madam, any suggestions about maintaining health the way you are at this point at 95? If we all should be like that. So food habits or exercise, or what exactly the secret of your energy?
I would say I had learned pranayam yoga. I had attended a yoga camp for 21 days. There we were taught pranayams and this relaxation exercises and all that. So that I continued. Maybe that is the secret of my energy and probably sharpness.
Wonderful results, madam. Meaning, I was not quite sure how long I'll be able to converse with you. Okay, but then you're as fresh as you were. You the way you started. Okay.
Surya Namaskar also. I used to do Surya Namaskar, I remember, which was very good. But later, as I later on, maybe in my 30s, I started getting backache. And the orthopedic surgeon suggested that I stop doing Surya Namaskars. But I used to do them till then. And I continue with the pranayam at least, and just few asanas, very few. Now, I don't do much. But pranayams I do.
And
So
your association with the institute. Sorry, go ahead, madam. Yeah.
yoga is really, really helpful. That was the last thing I learned, and I stayed with that. And I was also on the faculty of the Yoga Institute at Santa Cruz East. There's a very well-known yoga institute, which they teach. They have courses, regular courses of different durations, and teachers training as well.
You've been in UK now for about 8 years, as you said,
Yeah,
London.
yeah,
So,
yeah.
what is your perception, personal experience?
It's very nice at my daughter's place. I used to earlier on during my vacations, I used to come because to see my grandchildren. I used to come, and both Manu, that my son-in-law, and Vinita, both are very nice persons, very generous, and they give me all facilities if I want to paint or draw or sculpt or do anything. All the materials they provide for me. So I do some sculpture.
Is this artwork on the screen behind you that is
But
done by you, madam? There's an
what?
artwork on the wall behind.
No,
Behind you, there is a
no. Yeah, but that Manu has put it up. माझं काहीतरी तिकडे असलं तर घेऊन ये माझं कुठलं तरी drawing, painting काहीतरी. When I came here, I joined the art group in this ingot stone in the village hall. There was a art group. So once a week we used to meet, and we used to meet, and they at the beginning of the year we used to make a list of everyone had to suggest topics, and from that a list was made. Some things were picked up, and for each week there was a topic for painting or drawing, and we could do that during those 2 hours that we were there. So I went there for 4 years, and at the COVID, when the COVID started, our club closed up. Till then I was going. But they have restarted, but I haven't gone again.
Madam, any memories about canteen, etc., in the college campus at your time?
I don't, because I hardly visited the canteen. I used to I used to get a dabba from home for my lunch. And I came home. I didn't revisit the canteen.
And the Gymkhana of the institution, GS Medical College. and
The
magazine.
Gymkhana, I was not a sports person. There was a table tennis table in our ladies' common room. There I used to play table tennis. One of my classmates, Dr. Vaijayanti Thakur, she was a very good player. And so in the ladies' room, I used to play table tennis with her. That was the only play activity that I did. But I used to like to walk. I was a regular uh, walker for half an hour, where in the society that I lived, there was a good, nice, big area for walking. So every evening I had a half an hour's walk there without fail. So that could be my fitness secret.
Yeah, right, certainly, madam. And it's nice that you continued your association with the institution, with your daughter joining there, and then later on, your son-in-law also is from
Yeah,
our same institution.
all are
Yeah.
governments. Yeah, this is one of my paintings. Yeah, good. Can you see?
Oh, yeah. It's a little faint, but it's certainly seen. Yeah,
Yeah,
yeah, yeah. Lovely. Yeah.
this is a
And
fam-
you continue painting now, right?
yeah, sometimes yes, I do. But I have taken more to craft now. This was an operation theater scene painted by a famous Barbara Hepworth. Here is another one.
Oh,
There's another painting. This is
lovely.
Monet's painting.
We have a
So
WhatsApp group.
I was fond of visiting art galleries there in Mumbai. On Sunday afternoons, I used to visit art galleries.
In fact, we have a WhatsApp group of Gosumec for arts in particular.
Really?
Okay. So
I
yeah, so
would,
I'll add you there so
yeah, I
that
would
all
like
this
to,
can be pictures can be put.
yeah,
Yeah,
I would
it
like
will be
to
great.
join them.
Yeah, I'll
Yeah,
add you there in that place. Yeah.
yeah.
Madam, generally the duration of our these sessions is 1 hour, 6 to 7. Enthusiasm has led us to go beyond the scheduled time of. Okay, it's now
Yeah.
7:15 Indian
Okay.
Standard Time.
All right.
Yeah. So we'll be winding up in 2-3 minutes. So in case any word of advice you would like to give for the present generation of students.
What advice, be one with the patients, know them well, know their background, and be sympathetic. That's
Yeah,
all.
that's it. So can we conclude today's session, madam?
Yeah. We'll conclude.
Yeah. No,
Bye.
there'll be after this.
Hmm?
There will be a student volunteer. There will be a meaning. This is these virtual unions are being published as a book termed Reflections.
Oh,
So
I see.
wherein you can send in inputs, either in art form, anything, any of your contributions, which will be published in that place. So some information related to that will be given after this meeting in this same. And then the student will end up the program with vote of thanks. And then after that, the recording will be stopped and the link will be disconnected. And then this YouTube recording of this will be, I will send it to you. This will be there for posterity in our, and we'll be having one of 1946 batch in an interview with Dr. R.S. Satoskar. your batchmate
nice.
from pharmacology,
Yeah. I would
pre-recorded
like to
interview.
talk to him. Yeah. And what about Dr. Kekre?
Kekre, I'm not sure. I think he's no more.
Who I
So,
see.
I'm not, maybe meaning his wife also was dean at science or something. I think she, at the moment offhand, I don't recall. Okay, but if I get
Yeah.
any information, I'll certainly pass on to you.
Yeah.
I hope I have my information that I'm not sure of the exact data. One of them passed away because I
Okay.
attended the condolence meeting at Sion. Okay,
Okay.
but I'll just let you know whatever information I get.
And
Yeah.
what did you say? I didn't get it. The paintings, photographs are to be sent, or what is it? I didn't follow.
Meaning,
No?
no. After the presentation, wherein this details will be explained explicitly. Basically, there'll be a phone number. I will give you the contact. So you can send the pictures, etc., to that person for publishing it in that magazine.
All right.
Yeah. So that will be communicated in detail after this, after I disconnect this call.
All right.
So you can hold on till the bottom points is done. And then afterwards, the meeting will be ended. And the link will be disconnected by 7:30.
Okay.
Yeah. So should I ask the student representative to? Yeah. Okay.
Yeah.
Gauri?
Yes, sir. Yes, sir.
Yeah, you can
Yes.
take over, please.
Yes, sir. I request the tech team to play the reflection video by Swarupa Bhagwat.
A very good evening to you all. It is indeed my pleasure to speak about Reflections on Medical Humanities, annual volume published by Dr. Manu V.L.Kothari Chair and Division of Medical Humanities, Gosumec Alumni Association, under the patronage of Dr. Sangeeta Rawat, Dean, St. G.S. Medical College and KEM Hospital, Mumbai. The first issue of Reflections was published in the year 2019, the theme being History of Medicine, Looking Back to Improve the Future. The book comprises invited essays, poems, cartoons, quiz, crossword, and articles which were published before in different medical journals on evolution of branches and development of specialties in healthcare, great personalities and inventions in medicine and healthcare overall. The issue for the year 2020 was based on interpersonal relationships in healthcare. Again, invited essays and cartoons on doctor-patient relationship, doctor-doctor relationship, and medical teacher-student relationship were included. For the year 2021, we chose very apt theme of COVID-19, the human angle. Essays and poems in English, Hindi, Marathi, paintings and photographs contributed by teaching and non-teaching staff and students of St. G.S. Medical College and KEM Hospital who shared their experiences both on personal and professional fronts during the pandemic. The theme for the year 2022 was Literature and Medicine. It is a collection of articles, book reviews, and poems in English, Hindi, and Marathi, and also paintings and cartoons related to the theme. Now, for the years 2023 and 24, the proposed theme is Reminiscences, Our Days at St. G.S. Medical College and KEM Hospital. As we move towards the centenary year of our institution, let our fond memories come alive in the form of nostalgic writings about our learnings, not only medicine, but also life lessons that we learned here. Let us talk about our devoted teachers who inculcated values and shaped our lives, priceless friendships which we cherish lifelong. Our writings will instill a feeling of pride and a sense of belonging in all of us. The readers of the book, we as well as the future generations of students, will understand the power and beauty of expression and reflections. We will be enlightened about the history and glory of our institutions, past students who have contributed to the welfare of the society, and the role model teachers and mentors. We know, irrespective of the generation, we are bound by a common bond of being GSites. However, we also need to accept and adapt to changes which are inevitable following technological advances and societal transformations. At the same time, the students will learn that even though the changes are occurring, the humanitarian values and principles of ethics are unchanging. Hence, we appeal that the reminiscence and nostalgic memories shared on this platform of virtual reunions be expressed in the form of writings to be included in our next issue of Reflections. I, Dr. Swarupa Bhagwat, Editor Reflections and Associate Professor, Department of Transfusion Medicine at this institution, will be privileged to connect with the individual batch coordinators for sharing more details regarding the same. Thank you very much.
Swarupa, may I put in a word?
Yes,
My
madam.
book of poems has been printed. I have written poems in 5 languages:
Oh, that's
Hindi, Marathi, English, Sanskrit, and Konkani.
oh,
5 languages. So that book, my granddaughter got it printed, and
oh.
it's available. So what should I do about it with it? Can it come in the reflections?
Madam, madam, excerpts from that can be sent, and in the group Gosu Arts, which in WhatsApp, you can one every day a particular poem you can put in, so that all Gosumecs will have the pleasure, and all languages you can put in there. Okay, 1 page a day, 1 poem a day, whichever way you feel comfortable. Okay, so the entire thing will be covered, and
Okay.
for reflections, something can be picked up from there.
Yeah.
Okay, yeah. Now the student will be rendering the vote of thanks. Thank you very much, madam. I'll just hand over to the student.
Yeah.
Yeah, Gauri.
Yes, yes, sir.
Yeah, you can proceed with the vote of thanks.
Yes, sir. We did like to thank our Dean, Dr. Sangeeta Rawat Madam, and Academic Dean, Dr. Pathak, for their continued support and encouragement. We thank the Gosumec Alumni Association for administrative support for correspondence and financial transactions of Dr. Manu.M.V.L.Kothari, Chair and Division of Medical Humanities. We thank Mr. Tushar and Mr. Badal for audiovisual and technical support, Mr. Maitre for video recording. Last but not the least, I, I give a big thank you to Dr. Numidini ma'am for the interview.
Oh, welcome.